Good afternoon, everyone. Myself, Rajani, Assistant Professor, Department of Physics. Welcome you all to the third session of Induction Program Day 2. The more often we see something in our news feed, the more likely we are to think that it's true, even if we were originally skeptical. The third session is all about COVID-19 myths busted by Dr. Kruthi Chandrashekar. I feel extremely honored to welcome and introduce speaker of the session, Dr. Kruthi Chandrashekar, in this occasion. I welcome you, ma'am. Dr. Kruthi Vaisi is a daughter of dentist Dr. Chandrashekar and Dr. Avanti. She studied her secondary school level in Mandya and MBBS graduate from Mysore Medical College and also completed post-graduation, that is MD in respiratory medicine from Kasturiba Medical College, Manipal. Currently working as a pulmonologist at Mandya Institute of Medical Science. Her study on asthma was published in the prestigious Long India journals in August 2020. Presence of such a personality in a college during this pandemic is a blessing. We are very grateful to Dr. Kruthi Chandrashekar for accepting our invitation and marking her presence here. Now I would like to invite Dr. Kruthi Chandrashekar to take over the session. Thank you.
Hello everyone, a very good afternoon. I am Dr. Kruthi and today we are going to talk about COVID-19 and I'm going to bust few myths that you may have. Don't worry, after escaping the field of medicine and biology, all of you have entered engineering. I'm not going to bore you with a long lecture. So I'm just going to answer a few questions that you may have about the pandemic, clear any doubts that you may have, and bust myths that may be occupying your minds. All right. So feel free to ask any question at the end of the session. I have made it a point to cover most of my talk with FAQs so that we don't bore you and as well as answer your questions. So going on. So why do we have a talk? Why talk about COVID-19 to engineering students? So the whole year you have been bored of hearing all about COVID, Corona, the pandemic, and WHO, and so on. So I'm going to reiterate some facts that you already know about COVID-19. That is the intro of the maestro of the year. So, and why is it our concern? One, for you as students, and two, as general public. Then coming to do's and don'ts in the pandemic. Some of these may be already known to you. So I'll make it short and precise and let you know what you should do and what you should not. Then the majority of my talk will be based on FAQs where you will not be bored with slides. I'll just be asking questions and answering them myself so that most of the questions are covered. If anything is left out, you can ask me at the end of the session. Then we go to myths and facts. And rest assured, I have taken the facts from reliable websites like WHO and with reliable references. So you need not worry about the facts. And then about the road ahead. How do we live with the pandemic? Starting off with my talk. So if you expected me to walk in and just say that COVID-19 is a myth, then definitely not. I'm not going to say that. COVID-19 is definitely not a myth. It's an infectious disease, as you all know. It's caused by SARS-CoV-2 virus. This virus was named as such by the World Health Organization. It was first reported as in Wuhan, as you already know, in China, and declared a pandemic by the World Health Organization in March 2020. So, we all know what the symptoms are. Some of you may have even suffered with it in the last 1 year. So, some most common symptoms I have highlighted here, they are in bold. So, there could be cough, fever, sneezing, Sore throat, body ache, loss of taste or smell is a peculiar symptom of the virus and is present in most patients. So, breathlessness and fatigue. These are symptoms that are also common, and they are also known to last longer. So, they may last from 2 to 6 weeks in patients who have suffered from COVID. And one of the less common symptoms would be confusion, diarrhea, and chest pain. But yes, these are the symptoms of COVID-19. So, coming to importance of COVID-19 for us as students or as engineers. So, studies have shown that 13% students have delayed graduation because of COVID-19. 40% have lost their job, internship, or offer. 29% are expected to earn less at the age of 35. And these are the impact impacts of COVID-19 on students. So, coming to statistics. So, we all get a clear idea when it comes to statistics. And these are statistics as per last week, that is last week of December 2020. So, the world had 76.9 million cases of COVID 19 and 1.7 million deaths. It's not a small number. 1.7 million out of 76.9 million makes it 2.22 percentage, and it is quite a significant number. So in India, we had 10.1 million, and mortality as days come has shown a good trend, that is a decreasing trend. And now we have a mortality, that is deaths of 146,000, and that is 1.4 percentage. It is less than the world average, but of course, it varies from place to place and depends on the reporting also. So, as a doctor, let me tell you about the health related effects of COVID 19. Most patients will have mild or moderate disease. Some may be asymptomatic also, like you may already know or heard. So, some of you may have heard about it, some of you may have experienced it, or some of you may have read about it. But 10 to 15% of the infected people experience a severe form of the disease, out of which 5% are critical and will require ICU care. Again, as I told you, the mortality rate ranges from 2 to 5%. It varies. So, does COVID 19, you may think once a patient gets COVID 19 and he recovers, but still, can COVID 19 have any long term effects? Definitely, yes. COVID 19 has been known to have long term effects on the heart. It may damage the heart muscle tissue, it may damage the lungs, cause lung fibrosis, it may cause stroke, embolism, and a significant effect of COVID 19 is on mental health, and it may cause anxiety, depression, post traumatic stress disorder, etc. So, let us now go to what should you do in the pandemic. What is your role, what you should do, and what you should not. Coming to the do's in the COVID 19 situation. You may have heard of it a million times. I'm sure all caller tunes of all phones and brands have these uh, do's and don'ts, recited to you every time you call a person. So I'm going to recite it to you once again, because these are the stages when COVID-19 is residing. The first wave in most places has is coming down, especially if you take Mandya or Karnataka for instance. The first wave is coming down. The number of cases are residing, but that does not mean that we should let our guard down. So we should take our precautions and live with the same precautions and zest that we had earlier on in the disease, because there are some states like Delhi and Ahmedabad in India itself which have already reported a second wave. So maintain at least 1 meter distance from people, especially when you're outside, and try as much as possible to meet people outside. Outside, I mean, uh, open environments like a ground, park, field, etc. Not in houses, rooms, closed rooms without ventilation, those are extremely dangerous. And avoid air conditioning as much as possible, especially the central AC lines. So always open windows. So at some point on the other, the colleges, schools, and all places will reopen. So that time, what should you do? In a classroom, keep all windows open. Keep ventilation highest as possible, and wear a mask. So wearing a mask is not a taboo. It does not show that you are scared. Please continue wearing a mask, and I'll be talking about different types of masks and how to wear, when to wear, and why to wear. Regularly clean your hands. Washing hands with soap water is best, but if you sanitize it, it is acceptable as well. All right, so these were the do's. Now coming to don'ts. Avoid three C's, you know, closed spaces, crowds, and contact with people. So be it friends, you have gatherings, always try to maintain some distance between people. See that there is good ventilation over there, and avoid crowded places. Use don't use handshakes. Use namaste instead of handshake. All that you would have heard, but the problem comes when it comes to practicing it. It's not that we don't know, it's just that we don't practice. So don't visit high risk places. So by high risk places, I would mean where patients, where people sing or shout, there's a lot of spreading of aerosols. So these are high risk places, and that could be in restaurants, nightclubs, singing or fitness classes, because those could be places where the aerosols are being spread out fast. And then even closed buses, air conditioned buses, all these also will be high risk areas. If you cannot avoid, please mask yourself when you cannot prevent yourself being within 1 meter distance from others, but at least just maintain the hand washing and uh, masking yourself. So next is, don't panic. Even if you have been in contact with a COVID-19 patient, whether you have developed any symptoms, whether you've heard about any family member being infected with COVID-19, you've heard about deaths or severe cases, please don't panic. It's all in control now. We in the beginning of the pandemic, yes, the nation did face a very crisis situation where we did not have hospital beds, we did not have enough ventilators, we did not have oxygen beds and ambulances. But now I can safely say that we have the situation well in hand. The private and the public healthcare system is well equipped. Even if there is a rise of cases, even if there are severe cases, we can handle them. So don't panic and don't be anxious. Now, coming to frequently asked questions. So, all these questions may be, lingering in your heads. Some of them may be already answered. So, that would be a repetition, but I'm still going to go ahead and answer them for you. All right. So, when do we go to a doctor? You know, do I go to a doctor even if I get a cold, if I sneeze once, if I feel feverish? Now the weather's turning cold, so uh, we might eat outside, drink outside. So, even for the smallest of symptoms, do I go to a doctor or do I not? So, I would say if you are, you have that typical symptoms like fever, body ache, headache, and loss of smell, or if you know you have been in contact with a COVID-19 patient. So I would tell you, first you do is self isolate. And if the symptoms are even if you are at home, I would tell you self isolation and distancing is a must. So quarantine yourself in one separate room. Be away from the rest of your house, because you may have children, you may have elderly, you may have diabetics or hypertensive patients at your house. So please do not put them at risk. Isolate yourself. Call up a healthcare person that a doctor preferably, so they will guide you as to what to do next. And if in case you have you know moderate or severe symptoms like chest pain and breathlessness, you feel very very fatigued, you cannot eat your food, all these things call for admission to hospital. And for that you can call an ambulance or a healthcare facility nearest to you, and they will come to you, pick you up at your house and get you tested. All right. So this was if you develop any symptoms. And otherwise, it's always better for very small things. If you have just a cold, if you're already having allergy from a very long time, you don't need to go to a tertiary care center for that. You can just now in amidst the pandemic, we always encourage patients to even over telephonic consultation or even video consultation, we do accept patients, people who are scared to come to the hospitals during the pandemic. If possible, we do attend them via just telephonic conversations, which was not being done earlier. But till the pandemic subsides, yes, this can be done. That is only for mild cases. For moderate to severe cases, yes, you have to consult a doctor, you have to get tested, and you will receive appropriate treatment at healthcare facilities. So now, next question is: so we have self isolated. Can I spread COVID 19 even if I have mild symptoms? So you have just a fever or running nose or sore throat, body ache. You're just feeling fatigued. You are 17 or 18 years old. You are very confident about your fitness. You have like gone to the gym you every day and maintained your fitness really good. So you'll feel I need not go to the doctor at all. If I just go on doing my usual work as before, roaming around, is it as acceptable? So I will say yes. No, it's definitely not acceptable, because even patients with mild symptoms have been known to transmit COVID-19. So even if you just go out and sneeze once, it's enough to spread COVID-19 to the people around you. So you may unnecessarily put innocent people at risk, and even if you may not be becoming critical, you may put the others at risk. So I'll tell you, even if you have mild symptoms, if you can manage on your own with consulting a doctor, it's well and good, but please self isolate. Do not go around and spread the disease to others. And about asymptomatic people transmitting to others, no, it is we have very less information about asymptomatic people transmitting to others. So I unless you have a household and a person you have been definitely in contact with who is suffering from COVID-19, then it's unlikely that you will transmit the disease to anybody, and you need not get tested in that matter. So now you feel that you definitely have COVID 19 and you're very anxious. You want to get tested for COVID 19. So when do you have to get tested? If you've already been in contact with a COVID 19 patient and you have not yet developed symptoms, I will tell you it's advisable to get a COVID 19 test if you are anxious and if you think that you're suffering from COVID 19. It should be done after 5 days of the contact with the person, because before that it has high probability of coming negative. So you there's no point in getting the test at that point in time. So if you're already symptomatic, yes, you can go ahead and get tested. So where will you get tested for COVID-19? Almost all government facilities have now started testing for the SARS-CoV-2 virus. We have two tests. I'll be telling about them to you. So definitely tertiary care health centers will have testing facility for COVID-19. There are some private laboratories also who are taking up the test now. So depending on your area, so there is no place that will not test now, because earlier lab they used to send to the metropolitan cities, or there were lesser labs that were doing the test. But now almost every city and town has COVID-19 testing facility. All right. So now coming to the tests that are available for COVID-19. We have two tests majorly for COVID-19, and both these tests involve swabbing of your one is the nostrils. It's called a nasopharyngeal swab, and one is the oropharyngeal swab. They'll take a swab from your nostrils and from your throat. That is for a test called a RT-PCR, reverse transcriptase PCR. That's a highly reliable test, and that if that comes positive, yes, you're definitely suffering from COVID-19. And if that comes negative, it's very less likely that you're suffering from COVID-19. So that's called the RT-PCR. And we have another test called the antigen test, popularly known as the rat test. This rat test is a first line investigation for suspects of COVID, and it's easily done. So it may not need two swabs. Even a nasopharyngeal swab will do. But if there's anybody telling you they will do a blood test for COVID-19, it's not done to test if you are actively infected. It is just an antibody test. It's not a test to detect infection. So this rat and RT-PCR are the two tests to actually detect COVID-19 in patients. So, how do I check if I have got COVID-19 infection in the past? There are very enthusiastic people. They want to just see, let me see if I have already got it. I have suffered from cold many times in the last 1 year. So, one of them could be COVID-19. So, I just want to know if I have already got infected so that now I can roam around easily without wearing a mask. I will say not very advisable. Do not get yourself tested for antibodies like that, because today you may have antibodies in blood and it may not be there after 3 weeks. So I do not want you to get false confidence that you already have antibodies, because as of now we don't have studies to say whether people are going to have long term immunity with COVID-19 just after a single infection. So you yes, you can test if you've got COVID-19 infection in the past. It may or may not be foolproof in your language. So there is antibody testing for COVID-19 to know if you have got infection in the past, but it may be negative and it may be positive also. And today if you come positive, the for the antibodies, it may become negative after 3 weeks, and the COVID-19 pandemic may not, be cleared after 3 weeks. That is one thing I want to tell you. So, what do I do if someone at home is sick? So, should I go out? Should I stay at home? Should I immediately get myself tested? Well, it all depends on how close contact you were in with that patient. So if you were definitely in, within 1 meter distance, you've had the physical contact with the patient, then yes, you are very, very likely to be infected, because this is quite, the transmission rate is quite high. So if you are living in the same household and has physical contact, yes, you can get tested, and you can self isolate yourself for that period of time. And yes, for regarding that particular person, it is advisable to get them tested. And if they are above 50, if they are hypertensive or diabetic, not only get tested, prefer a hospital admission instead of home isolation. So next, if colleges begin, you're all going to colleges, should I play cool, like, oh, I don't really care about this pandemic, why are actually people going through all this trouble of isolation, distancing, masks? I'm a really cool dude, and I'm going to ignore all these. So I'll say, please do not do that. It's going to put yourself and others at risk. So under 20, it's not known that nobody is actually very safe from COVID-19. Yes, if you are fit and healthy, it's less likely that you may end up with severe infection, but you never know. There have been cases reported of severe cases, deaths, and even long-term effects in even perfectly fine individuals. So I advise you, this is not really the time to play the cool dude role. So stick to the rules and take all precautions. When I say that, I won't tell you to have obsessive compulsive disorders and uh, make occupy the whole of your mind with COVID-19. No, live your life the way you used to, but with the precautions I told you to follow. So now the all news, everywhere you read, there's a huge hue and cry about the UK strain. So what's all this fuss about the UK strain? Yes, it's a mutated strain of COVID-19, and it is known to have a higher rate of transmission than the previous strain. Already 3 4 strains have there were initial reports of mutation, and this is a fairly recent mutated strains. So should I be very worried about it? I'd say no. This UK strain, though it's a mutated strain with a higher rate of transmission, it is known to be less dangerous than the previous strains. So yes, there could be a second wave of infection there, if we do not take precautions, but it's not as dangerous as the previous strains. So it's not just the one UK strain that we may face. We may be facing a lot many strains that could be mutated. So there could be a Indian strain, there could be a Mandya strain in future that we could hear of. But let's not panic at each strain that comes. Let us take our precautions, live the life we used to, with certain with without letting our guard down. I think that should suffice. Not worry whether the vaccine will protect us from the UK strain, or if there's somebody coming from UK, we should you know so stay away from them. Nothing like that. So the government is taking precautions regarding all that. You need not put yourself at worry. So can a person once infected can get reinfected? So maybe you have already got tested once, you come positive, everybody in your house was positive at that time, at that point in time, and now you want to know whether is any chance of getting reinfected. There have been reports of people getting reinfected with this disease. The chances are very less, like around 1% chances, but it's not a no. So I will not say that you cannot get reinfected if you have suffered from the disease once, but there are less chances that you get reinfected. But you have already got moderate to severe symptoms. The same patient, if they do get reinfected once, yes, they are presumed to be at higher risk. So does presence of antibodies, now there's antibody testing, and it's available at many places, so many people may have already gone and got it done. So but does that mean that the person is immune? As I told you earlier, these antibodies are something that our body produces to fight this virus, and they may not last forever. Like once you get chickenpox, it's very unlikely that your immune system is known to confer a very long immunity. That way, we know very less about COVID-19. We have just seen COVID for the past 1 year. We don't know whether it's going to give lifelong immunity. And many reports have shown that these antibodies have lasted as long as 3 weeks to 3 months, and many a times they have become antibody negative. So there are very varied reports regarding these antibodies. So I think it's better not to get any false confidence if you test positive for antibodies, and not to panic as well if you are don't have a significant antibody titer. So, uh, in the beginning of this COVID pandemic, we used to see many places like markets, supermarkets, and certain other places with something called as disinfection tunnel, corona disinfection tunnels. So, should you go through such tunnels and become think that that is one Agni Pariksha and go through it all the time? Definitely not. These disinfectants are supposed to be put on inanimate objects. So we have sanitizers that are made especially for like human use for the hands. So you use that specific thing for the hands. You are not supposed to spread, pour disinfectants all over yourself. So I'll advise you not to go through these disinfection tunnels to spray it all over your uh, face and body. It is not it's more harmful than beneficial. So now coming to the hero of the day, the mask. Should I always wear a mask? Not necessarily. Once you step out, you are going to be in close contact with people, or there is going to be less than uh, 2 meter distance from people. Then only should you wear mask. If you are exercising in the gym all by yourself, even if it is an outside gym, I would tell you not to. You need not wear the mask itself, because it's not going to stay in the on inanimate objects or stay in the air forever. The virus won't stay like that. So only if you're in close contact with people, you go outside in crowded places, then you have to wear a mask. But if you're all by yourself, or the people are already very much distance, then yes, you can do away with the mask. And even while exercising, like if you're walking alone in a ground, where there is sufficient distance between you and the other people, yes, you need not wear mask at that time. So what type of mask do I wear? Now you have N95 respirators, you have masks, you have cloth masks, there are designer masks. So what there are surgical masks also. So what kind of masks do you have to wear? Yes, N95 gives, highest protection. The respirators also give protection. But if you're not going to be in contact with high risk individuals, not going, people working in hospitals, healthcare workers who are going to be in contact with patients of or suspects of COVID-19, have to definitely wear N95 masks. And otherwise, yes, just cloth masks will do, which are fitting your face quite well. Not cover only your mouth, not cover only your nose, or keep it hanging halfway. All these things are to be definitely avoided. So you can wear a fabric masks, that will do as well. But if you're already suffering from any problem, there are many childhood conditions. So young adults also may be suffering from asthma, allergy, or some other congenital childhood conditions. So if you are at a higher risk, then yes, prefer at least a 3 layered mask, that is a surgical masks, that would be advisable. And if you are wearing a N95, there's absolutely no problem. If you're comfortable wearing them, there's no reason not to wear them. So how do I wear mask? So some people keep on reusing the mask, again and again and again. These disposable surgical masks are not for reuse. Okay. They are to be disposed. So if you're not disposing the mask every day, better use a fabric mask that you can wash and reuse again, instead of buying a disposable mask and wearing the same thing again and again. And regarding N95, yes, there have been certain studies. Every fifth day we can use them. So you keep a set of 5 N95 masks. First day you wear, again fifth day same thing. This is what was being done in hospital when there is scarcity of masks. But for general public, you may not need N95. So I would tell you a fabric mask that can be washed is better. So how do you wear? So you hold the mask handle, what you can call, and don't touch the front of the mask. Once you wear a mask, don't keep adjusting, pulling it up or down by touching the mask that is exposed to outside. That spoils the whole point of wearing the mask. So you have to touch only the handles, which are going to be put over the ear. Remove it, wear the mask with the same things. Do not touch the outside of the mask. And do not, if you have by mistake touched, then please wash your hands, so that you do not contaminate yourself. Now, coming to reusing of a mask, I have already told you about the reusing mask. So now people have started traveling already. Can you stay in hotels? There are many hotels now that are meeting standards of sanitizing, high safety precautions, very hygienic places. So if they are already practicing all the rules, and there's distancing, definitely you can stay in hotels. There's nothing against staying in hotels. And so can you use the same bed sheet which they have put? So if that hotel is you can, if you think that hotel is trustworthy, then obviously they would have you know uh, uh, sanitized the whole place and given you fresh things. So definitely you can use it. And for more than one day, the virus staying on inanimate objects is hardly known, and it's they're not known to transmit the virus as well. So there's no harm in staying in hotels. When can I travel? uh, as much as possible, avoid travel unless it's absolutely necessary. And if you cannot it cannot be avoided, then yes, wear a mask, avoid air conditioned places, and you know take all your precautions like hand sanitization, hand washing. That should do when you travel. And who can travel? People who are already at higher risk of the severe COVID infection. They will be they should take more precautions. They should avoid travel, especially in uh, public or crowded vehicles. So that's what I'd say. If you already are suffering from any condition, if your health status is already weak, then they should avoid travel. Otherwise, others can with precautions. So, does one need to wear gloves all the time? No, not necessary. Actually, when you wear gloves, you keep forgetting that where what places you have touched. You touch some other object, then you may touch your face. The gloves may be more contaminated than your hands. Whereas when you use your hands, you'll know as soon as you've touched outside, you can sanitize your hands. But the same cannot be done with gloves. So I'll say it's advisable not to wear gloves, but to keep your hands sanitized as when you go outside or you know touch other things. Now, this is one thing that was very, popular in all households. That is, as soon as we get groceries, fruits, vegetables, products from Amazon, sanitize all of them. So actually, it's not, the virus has not been known so far to have been transmitted via all these products, inanimate products. So the virus is usually transmitted from one person to another, very very less from all these products. So wash fruits as you used to before, so before consuming them. And there's no need to disinfect all products, and even clothes. If you go outside and come, just dip it all in Dettol or disinfectants. Not necessary. unless you know that you have visited or that those clothes have been exposed to covid-19. You've been in a covid-19 ward or in the same room as the covid-19 patient, then yes, there's a point disinfecting them. Otherwise, no, you just need to wash your clothes, wash your fruits as you used to before. So you don't take notes from people thinking that they transmit COVID-19. No. Again, as I told you before, bank notes or other products have not been known to transmit COVID-19. Now, the million-dollar question: should I get vaccinated? Should a person once infected take a vaccine? So the vaccine is it will probably come in a month or so to the government facilities, and the government is taking enough care to vaccinate the entire population. So they have specific plans of doing the whole process, and people will be vaccinated as per priority. So you need not worry about that. Government will take care, and it may be available in the private setup also. So people who do wish to volunteer and get themselves vaccinated, I think that also may come into the market once there is sufficient production. Almost all vaccines are in the final stages of trial, and so far they have shown some promise that of giving long lasting immunity. That would be around 70 to 80%. That one cannot guarantee that once you are vaccinated you will have no disease, but there are chances that the chances of very severe disease would be lesser, and the risk of uh, um, mortality will be lesser. That is what is shown in these trials. And whether some people may have some mild infections, just like a flu. You may get a fever, mild symptoms of the disease. So we that's not unexpected. So, whether a person once infected should take the vaccine? Yes. For a person once infected, the rules are same as a non-infected person. So, COVID-19 infection is not known to give long-lasting immunity. So, it may. So, you are just similar to any other person. So, the risk, and benefits remain the same. So, is the vaccine an answer or just another question? There are so many reports of side effects, adverse effects, facial palsies, and all these things of vaccines. Don't worry, the vaccine will be given to people only after the vaccine clears all trials. So I think that depends on you know um, all these they're not going to bypass safety issues just to vaccinate people. But yes, every drug has its effect and side effect. Just like that, every vaccine may have side effect. It may cause pain, it may cause flu like symptoms, and life threatening side effects as of now are unknown. But before giving out to the market, they will definitely take care of that. But then it's all up to you, whether you take the vaccine or not. So will the vaccine protect us from the UK strains? Now their strains are getting mutated. So should I get vaccinated again and again? No, just one mutation, one small mutation in the vaccine will not, in the COVID-19 virus, will not, change the entire virus. So it's very likely that the vaccine may protect you from different strains of the virus. Only after maybe 6 months to 1 year, the virus may have so many mutations that it will become, totally different. That time a new vaccine may be needed with more strains in it. So now, along with this pandemic, we had one more problem. That is the, let's call it the infodemic. Okay, we have so many rumors going around. The rumors causing more panic than the actual disease itself. So I'll ask you not to be a part of spreading these rumors. So you can be this one person who didn't send a rumor to anybody. Yeah, so there is no rumor going around to people. And then again, you can there are people who send rumors, but the second person, if you double check your facts, then again the rumor will not be spread to people. You can there are so many fact checkers available now with all these technology and websites and health websites. The WHO itself has clarified so many of the myths that are around the virus. So you can always check before forwarding any information to others. So otherwise you have your trusted sources. Maybe it's a, person who already knows the subject. So if you can ask them about it before you transmit it to others. So along with breaking the chain of transmission of the virus, I'll ask you to flatten the infodemic as well. So with the let's not spread the rumor, or just ask back the person who has sent it to you, asking like, how do you know it's true? Is it from a trustworthy source, or has it been fact checked at least once? Now coming to uh, busting myths, I think this I have taken it directly from the WHO site, so you need not worry about the reliability. Does the corona virus affect only older people, or are younger people also susceptible? Now we know that vaccine, if it comes, it's first going to be given to high priority people like healthcare workers, people above 50, and the people working frontline like the police officers or municipality workers, and so on and so forth. So does that mean that young people are not susceptible? No, young any all people are susceptible, but the thing is that older people and people with pre-existing medical diseases like asthma, diabetes, hypertension, heart disease, these are more likely to become severely ill if they are affected by the virus. So it's advisable that everyone takes steps to protect themselves from the high virus, not just a certain set of people. Okay, like you lock the your grandfather at home, you go around, visit the whole place, get yourself infected and come home to him, would spoil the whole point of him staying at home. So swimming pools transmit COVID. So that's the only reason that's the swimming pools are not opened. It's not true. Water or swimming pools do not transmit COVID-19 virus. You can visit swimming pools if distancing is maintained. This is what the WHO has issued. But you should again there also avoid crowds, maintain a distance at least from others. And when you're not in water, do wear a mask. All right. And if you're symptomatic, please don't go. So, some people say that hold your breath for 10 seconds and see. And if you're able to do that, you're not suffering from COVID-19. That is definitely false. So, even if you're holding your breath for 10, 20, or 30 seconds, that has no connection with COVID-19 or whatsoever, or any other lung disease. So, the only a laboratory test for COVID-19 can confirm the disease, and not any such breath holding tests or maneuvers. All right. So some people feel that wearing mask for a long time gives you oxygen deficiency. No, definitely not. Wearing mask for a longer time does not cause CO2 intoxication or oxygen deficiency. So as long as you are using a mask, you see that it's allowing you to breathe normally. You can use it. Do not again use a damp mask if it has already become damp, because sweat or secretions. Don't use a disposable mask again and again. That's it. But definitely it's not causing oxygen deficiency, or it's not life threatening to people. So Now vitamin supplementation. Yes, this is become a rage now. Everybody has started taking vitamin C, calcium supplementation, B complex, zinc, everything for to prevent COVID-19. That's not vitamin and mineral supplements do not cure or prevent COVID-19. Yes, we give to already proven COVID-19 patients, we are giving vitamin supplements, but that does not mean that you load yourself with all these supplements to prevent COVID-19. So now coming to the road ahead, what should we do? Like, is are we going to live with the pandemic forever? Are we going to remain locked down in our houses forever, and have a staggered growth in our respective fields? No, you need not. Everybody is moving on, so we should also move on. We should learn how to coexist with COVID 19. I told you the do's and I told you the don'ts. So always remember and move on with that. Go the extra mile. So if you have fallen a bit behind because of the pandemic, you can't just fall back. The whole world can't fall back a year because of the pandemic. You have to pace up and put in a little extra effort to catch up what you lost on. So if you go an extra mile, you can move forward. Otherwise, you will be lagging behind the rest of the world. Because yes, there are some people who have still made the best of the time they had. And so just because you have some time, you have all online classes, you can stay at home. Don't while it away was with Netflix and Amazon Prime and what not. There are so many options available to waste while away time. Let's not do that. Along with all this, let's not forget to eat, breathe, and sleep. Eat normally, keep yourself fit, because COVID 19 has been a test of every person's immunity. Be it you or me, a person who has remained healthy and fit, they have conquered the disease and not let the disease conquer them. So, sleep well, eat well, and breathe easy. Let's not let a little virus make the worst of us, and let us make the best of the situation in hand. So, being a pulmonologist, I have to put in a word about keeping your lungs healthy as well. Uh, this is the age like 17 to 25 and 30. This is the age when adolescents tend to develop habits that they will not know is habit forming and deleterious to their health, but they will regret at a point, at a stage when they cannot do much about it. So you may think that one or two cigarettes and one or two packs may not make a huge difference to your life later on, but believe me, it does. Okay. I've you may think that there are many people who have not smoked who still end up with lung cancer, and there are people who have smoked dozens of cigarettes, they also end up with the same cancer. But as doctors, we do know the difference between people who have never smoked and getting a lung cancer. They respond to treatment really really well. But as if a smoker ends up with lung cancer, we cannot do much about it. We'll just make a counsel them and tell them, see, this is your fate. And no, we'll give them treatment. Obviously, that's not that we won't give, but there's not much in our hands. But if you from your side have not da- uh, done damage to your own health, then we also can help you to a large extent. So it's not just to the lungs that tobacco has its harmful effects. It affects the heart, increases coronary heart disease, that is a heart attack, by at least 2 to 4 times. It increases the risk of stroke by 2 to 4 times, and increases the lung incidence of lung cancer by 25 times. And almost 90% of lung cancer all over the world is caused by tobacco in men as well as women. And it's not now it's tobacco, smoking is not a problem of men alone. It's problem of men as well as women. So like if this is a causes of death. So tobacco, as you can see in this circle of death, it is tobacco related causes of death, occupy such a major portion of the burden. Other consumables or disease like AIDS, alcohol, suicide, homicide, accident, that is taking a smaller part, whereas tobacco is taking a major part. And it can cause cancer of the liver, stomach, mouth, bladder, and can harm the kidneys, lungs, and hearts as well. In the one single cigarette that you smoke, there are more than 4,000 chemicals in the tobacco smoke, and at least 250 chemicals are known to cause cancer, and they are harmful to people. So even if you the smokers do not end up with cancer, there's another disease called COPD, which is very brings down the quality of your life. So the other diseases, so along with the people who are suffering from COVID-19, maybe diabetes, heart disease, or maybe they are not in your hands, but the harmful effects of smoking, yes, it's completely in your hands. Do not let yourself to be a victim to such noxious chemicals. So coming to the take home message, avoid all rumors. This is just a gist of my whole talk today. That ABCD I can say of my talk: avoid rumors, be masked, stay safe. Crowds are always dangerous. So, two is a company, three is a crowd. Always remember that. So, avoid crowds, distance yourself by 1 meter. We do not know when that pandemic is going to end, but you are facing this as well as me. So, let's not, stress ourselves by this, but not take it too easy as well. Eat healthy, exercise well, keep yourself fit. Frequently wash hands, give up touching your face. Stay at home, stay safe. Isolate if you're ill. Do not forget that. So, yes, this ends my talk for today. And if you have any doubts, queries, you can always ask me now. If not, I'm sure I can share my mail ID with you. If you have any queries, I can answer them as well. All right. Thank you very much. This is Dr. Kriti here. If anyone has queries, you can. I'm open for discussion.
Thank you, ma'am. Some students have queries. The
Sure.
vaccines are said to be having some major side effects. So will it be effects? Will be safe to get vaccinated when the vaccines are released for the public?
Yeah, that is a very valid question. So the vaccine is going to be released only after they pass tests on individuals. For the vaccines have they have to face trials first on animals, then on healthy volunteers, then on patients. So other than pregnant individuals and children, so these are two populations that the vaccine has not been tested on, and these people are not advised to get the vaccine. Pregnant individuals and children. Other population, yes, adults can get vaccinated, and as of now, no short term effects have been found. Life threatening side effects have been found. It is found to confer immunity and prevent severe disease of COVID-19. So I cannot guarantee that there will be absolutely no side effect. Mild symptoms, flu like symptoms have been known to be caused by the vaccine, but yes, life threatening complications as side effects have not been found as of now, but they are still in most many vaccines are still in the phase 3 trial. So they will be released only if they clear the trials. And there are many government governing bodies to monitor that the safety and credibility of these vaccines when they are released.
Thank you, ma'am.
Yeah.
Now I request Nityashri, ma'am. Sorry. One more query.
Okay.
Why novel coronavirus, not only coronavirus?
Because the previous virus was also called as coronavirus. We know that there has been, SARS before. So this is a SARS-CoV-2. This is not the first strain of coronavirus to infect humans, because there has already been a coronavirus which has caused SARS in the past. So that was called as SARS and this has been named by the WHO as the SARS-CoV-2 or the novel coronavirus. So, because it's not the first time the coronavirus has come, but it's not completely similar to the older coronavirus. So they could not just call it the same. They did not call it just coronavirus. They called it SARS-CoV-2 or the novel coronavirus because it's a newer form of coronavirus. There are similarities, but it's not completely the same.
One more query, ma'am. Blood plasma transfer from cured people
Yeah.
to cured peoples to infected peoples is more effective to kill COVID-19.
Actually, the initially plasma therapy was considered the mode of treatment, and many patients have been treated with plasma therapy, but it did not show much promise to cure the COVID or help in the management. So as of now, plasma therapy is not a preferred mode of treatment, I can say. All patients who are cured may not be able to that plasma may not be able to protect the other patient from the disease. So it all depends on the antibody titers first only. If antibody titer is high, then plasma may be collected from that individual. But again, now as of now, we are our first line of treatment is not plasma therapy is not really a recommended choice. We have antiviral drugs and other modes of treatment. As of now, even as per the guidelines, standard guidelines, plasma therapy is not our first choice, I guess.
Thank you. One more query.
Yeah.
Is Arogya Setu app useful in diagnosing COVID-19 in the place where we are?
Actually, I will not say that it's useful in diagnosing COVID-19. It depends on a lot of factors. If your, people around you have actually reported symptoms, supposing I have COVID-19 and a person 1 meter away, both of us have Arogya Setu app. Only if I report of my symptoms, if I get myself tested, all patients who are getting their self tested will be or they'll be updated. But if you don't report symptoms, it's not a foolproof app. So but if you there's a confirmed patient, then you'll come to know. But that confirmed patient will be monitored strictly and they'll be isolated. But for mild symptoms or patients who have not reported, Arogya Setu app cannot do much about them. So yes, it is a good app, but I will not tell it's 100% guarantee that there's nobody around you that who are suffering from COVID-19 or symptoms.
Thank you, ma'am.
Ma'am, one more query.
Okay.
Is it safe for us to wear mask for house also?
For at home, I would not advise you to wear a mask. Like if you have a symptomatic COVID-19 individual at home, isolate that person. It may be a little difficult for you to isolate. You'll need to have rooms in your house for that, and uh, provision for the same. But I will tell, keep your house ventilation good, keep yourself spaced. You need not wear a mask all the time. If there is a symptomatic patient, please isolate them in one room. The rest of the people can stay in the rest of the house. You need not wear a mask at home.
Okay.
Okay, thank you, ma'am.
Okay.
Used. One more.
Is it safe to live in hostel?
Yes, now this question is going to crop up because I think we can't indefinitely postpone colleges and hostels forever. So at some point in time, people will have to stay in hostel. So I will tell the same to you. If you are going to live, with a roommate, ask them also to take some precautions. Avoid, close contact. Avoid parties and such things for some time. But you may be using a common bathroom, and you may be using common doors. When you use frequently touched objects like doorknobs, or if you're doing self service, you're using some frequently used objects which are being used by others as well, then practice hand sanitization and distancing. That is all that we can do for now. We can't completely live in a protected bubble. We have to come out of it, but let's take our precautions, I'll say.
Ma'am, one more query. Is it safe for us to
So
wear
yes,
masks
you
for
when
hours?
you are going to live in hostel, you have to.
Okay, ma'am. Fine. Ma'am, one more
For
query.
us, yeah, you can. Okay.
Okay. Is it safe for us to wear mask for hours?
Yes,
Means
you
too many
can
hours.
wear masks. For too many hours, I'm sure you are not going to be wearing the mask for very very long time, like 6 8 hours. When we are doing duties, we do have to wear masks. We go right into COVID wards. We have 4 5 layers of masks and shields and whatnot over us. And yes, I we don't become breathless at that time. It is little suffocating, but if you wear, that was one myth I cleared. You're not going to end up with oxygen deficiency just because you're wearing masks. It should be well fitted and proper for your face. Like, don't wear too small a mask or too tight fitting. Then there won't be any problem, even if you wear mask for many hours.
Okay, ma'am. Uh,
Okay.
and one more query, ma'am. Is this new strain is cause earlier death?
No, the new strain is it spreads faster. It's more communicable. Like from if one person could earlier spread to 3 people, it may spread to 5 people. So it's easily transmissible. That is what is known about this new strain. But it is not more dangerous. It does not cause more deaths than the old strain.
Thank you, ma'am.
Okay.
Now I request Professor Nityashri to give vote of thanks.
Good afternoon, everyone. Hi, I am Nityashri CK, working as Assistant Professor in the Department of Physics, PS College of Engineering, Mandya. So it has been 10 long months since we lead our normal lifestyle, right from greeting people to traveling. Now we are stuck in this COVID-19 pandemic, like a boat in the middle of the ocean without clue about what will happen when. Even after lockdown and other precautions such as use of masks, sanitizer, social distancing, it is not 100% in our control to prevent us from getting infected with this coronavirus. This is because we have seen many people being asymptomatic and communicating the infection without their knowledge. Also, even after proper sanitization and use of mask, we have seen people getting infected. But the severity of disease the patient develops depends on his age, immunity, and other comorbid conditions also. We don't even have 100% sensitive tests to detect the infection. So many infected people are diagnosed.
as negative as the sensitivity of our test is only 70%. Even after proper diagnosis also, we don't have proper target treatment for COVID, and hence we are just following conservative and empirical treatment protocol everywhere. So in order to decrease the severity, at least we need to follow all the rules told by the government, and we need to fight against this deadly virus by following all the precautionary measures. Okay, so it's my pleasure to give vote of thanks to Dr. Kruthi Chandrashekar Madam on this special occasion. I take this golden opportunity to thank the respected chief guest of this occasion, Dr. Kruthi Madam, for attending this session in her busy schedule. I would like to express our sincere thanks to Dr. Kruthi Madam for giving excellent speech on COVID-19 myths busted. We really express our gratefulness to you, Madam, for providing encouragement on facing COVID-19. Once again, I would like to say that we are most grateful to you, Madam. We thank you for being with us this session. It is a great pleasure. Thank you very much, Madam.
Yes, you're welcome. And I also thank the organizers for giving this opportunity to speak to students about COVID-19. It was definitely a pleasure to speak to all students and meet you people. So, all the best to all the students for the coming year, and Happy New Year to all of you.
Thank you, Madam. I extend my gratitude to the respected Principal Dr. H.V. Ravindra sir. Thank you, sir. Finally, I would like to take this opportunity to record my heartfelt thanks to professors and my dear colleague, especially induction program coordinators, for their heavy cooperation in the organization of this program. We are happy to declare our thankfulness to our beloved students. Thank you all for participating in this occasion. And for your kind information, your attendance will be taken through the Google form. We should treat your valuable feedback as your attendance. So please, all of you, fill that feedback. And the next session is Alumni Affairs and Tech Web. It will be starts at 3:30 p.m. Please, all of you, participate in that session also. Thank you. Thank you very much, madam.
Thank you.